Welcome, everybody. Today is June 14th, 2021, and we are recording this show for June 16th. I'm Trey Dobson, Chief Medical Officer at Southwestern Vermont Medical Center and an emergency medicine physician with Dartmouth-Hitchcock Health. And this is Medical Matters Weekly, a show about the aspects of healthcare that matter to you most. And my guest today that I'm so excited to have is Patty Ryan, who is the nurse leader of the Cardiac Rehabilitation Department at Southwestern Vermont Medical Center. Welcome, Patty.
Thank you. Happy to be here.
Well, we're happy to have you. You've been at SVMC for 31 years, I believe. Is that right?
Yes, and then some. I'll explain that later.
Okay, great.
Yeah.
And she's helped the department, she's done many things, helped the department achieve certification by the American Association of Cardiovascular and Pulmonary Rehabilitation, which has a long acronym, AACVPR, that I will not be able to repeat. And also, I will mention now, and we'll talk about too, is an incredible golfer, which is something that, is that a prerequisite for working?
I'm not an incredible golfer. I don't know where you got that info from, but thank you.
Oh, well, we're so excited to have you. So tell us a little bit, we're going to get into the medical aspect, but tell us a little bit about yourself, where you grew up, and how you eventually came to SVMC.
Okay, so I grew up in Hoosick Falls, New York. I'm the youngest of 6 children. I have my mom has passed away. My dad is still alive. He's 93 years old. We had extended family, 5 girls and 1 boy. And we grew up in a great neighborhood. You know, we spent most of our time outside. We had the athletic field across the way. We had an ice skating rink. We had a pool. We had a camp on a lake. So we did a lot of outdoor activities. And so I had a great childhood. Both my mother was an RN, and both of my sisters are RNs. So you could say it might run in my family.
Absolutely. Runs in your veins, I guess, for a nurse. So where do your sisters, where do they work?
Betsy works in Albany, New York, and Mima, my sister Mima, works up here in the OR. A lot of people don't know she's my sister because she's tall and thin, but she is. Yeah, Mima P.
Right. That's fantastic. And so you got drawn into it from a familial sort of experience there. And what else sort of drove you into nursing?
So I have to say, probably 1978, 79, I became a candy striper. I needed a summer job. And there were like 6 of us in the class. And we were taught by Marianne Delorier and Ruth Walbridge, who were wonderful instructors. I mean, we worked in the old Putnam building, and we learned how to get bed baths and back rubs and make hospital corners. And I have to say they were really about, I think nursing is an art and a science, and they were so artful. They just really taught us how, I feel, they taught us how to really take the patient nurse relationship into account and how important it was. And I'm telling you that sold me on the profession. I really wanted to go into nursing. So I attribute a lot of that to them.
That's a great story, and it really shows how you developed the compassion and attention to detail early in your career. And I know because you have so many fans out there in the audience that you've carried that through over these 30 years. So how did you end up then in cardiac rehab?
So I went to college, got my bachelor's of science, and they had from Hartwick. And they have a internship, which is very valuable. You go away for 2 months, you pick a hospital, and 2 of my sisters were down in the Philadelphia area. So I did my internship at University of Pennsylvania my senior year of college, and I was in the CCU in the MICU. So I developed a real affinity to critical care, and I learned so much. And then, like most internships, luckily I was offered a job there. So I went to University of Penn and worked for like 7 to 8 years in critical care. And
Wow.
So cardiac was kind of something I grew into and I loved. And I learned some great things about the heart, and got my critical care certification. And then for personal reasons, moved back after like 7 to 8 years back to this area. And I worked at Albany Med in their CCU. And then I got sick of commuting from Hoosick Falls. So I I knew this hospital and I always loved it. So I applied for the ICU job here. And then that turned into, and worked here for, since 91. And then I don't know how cardiac rehab, it was a small department and it was upstairs across from the ICU. And I think they needed nurses to fill in. And so I started filling in and doing per diem there. And then it became a full-time job and they offered it to me and I took it. So
Wow.
I've been in cardiac rehab since then.
Yeah, and the transition and the experience that you brought, for the audience, CCU stands for like a cardiac care unit, like an intensive care unit focused on just those with heart conditions that you might see at a larger hospital in a big city. But Patty's experience there and then taking that to cardiac rehab is invaluable because she's been through with patients their worst, most vulnerable time periods. And now she's working with them in this, part of the cardiac rehab, the word rehab, rehabilitation. So take us through what you do in rehab and what patients experience and what types of patients you see there.
Yeah, so cardiac rehab is the physician referred medical program. So we get a physician referral, and it combines exercise and strength training with risk factor education around your modifiable risk factors like sedentary lifestyle, diabetes, obesity, hypertension, smoking. What else am I missing, Trey? Let's see.
All of those risk factors for heart.
Hyperlipidemia. Yeah.
Mm-hmm, mm-hmm.
And so the clientele or the patient selection, it's driven by insurance a lot, but heart attack, stable angina, congestive heart failure, stents, heart transplants we've had. PAD is new, peripheral artery disease. They now approve cardiac rehab for that. And valve replacements. So that's our clientele. And they're there they can have up to 36 visits or 12 weeks. So we get them for like 3 months. The sessions usually last an hour to an hour and a half. And it includes, warm-ups and cool downs and introducing, we have aerobic exercise equipment there. We have a strength training, and then we have people who come in and educate, like the dietitian comes in and gives a talk. And then the 2 staff out on the floor are an RN and a physical therapist. So I have the pleasure of working with Robin Frazier, who's the physical therapist that works with me. And then Kathy Sleeman's our director. And then Sarah Ferguson fills in. And then my fill-in for nursing is generally Deb Berg and Deb Torito. And Deb Torito's a seasoned, ICU nurse from here. So, right. So a day would, they're referred to cardiac rehab, and we have the unique part of having a one-to-one with them before they even start exercise. So we have an orientation, and Dr. Rogi and Dr. Anisman are our medical directors. So they come down on like a Tuesday. They alternate week to week, and while I'm doing their orientation, the patient, if they have any questions for them or we have any concerns about the meds they're on or any concerns based on our assessment, we have the luxury of talking to them one-on-one. So that's really a unique experience. And that really sets the pace, I think, for the patient feeling comfortable. Right. They get oriented before they even go into the gym and exercise.
Right. And what a lot of the things you describe are sort of protocolized approach. But yet you talked about early in your career learning that art in nursing. And I know that you practice that because a lot of people talk about that personal relationship that you personally had developed with them through that 3 months. Talk to us a little bit about that and how that influences their aftercare.
Yeah, so I think it's the whole staff. We have a knowledgeable, professional, very empathetic staff. And I've learned, I don't know if it's a natural thing, but if you can make someone feel comfortable when they walk in the door, and get them in there that first day, then it's not being fake about it. It's being, pretty authentic. And recognizing that they're scared and they're vulnerable and their confidence is down. And if we can get them in the first day and reassure them, that is a real indication that they'll probably continue on with the sessions. We don't have a big dropout rate because they feel safe. I feel they feel safe and they get confident. And but the beauty of it really is the patient interactions with each other. Once a new person comes in, the other participants really embrace them. We can exercise up to 8 at a time. And even though the program's very individualized, they do get to know each other very well and they have conversations with each other. So, we're just kind of there listening, making sure they're safe, reassuring them. But the patients themselves and their interactions with each other really help to drive the positiveness of it.
Well, you and your team, I think the word I'll use are known for your sincerity. In other words, you said not being fake about it. That's absolutely right. It's recognizing the person in front of you. You may not know them for 3 months and that's it, but you have that 3 months to make a difference with them. And in order to do that, you have to be sincere or they will see right through there. I'm sure you've had lots of great successes and you've also had some where you didn't, the outcome wasn't what you expected. And I know quality is so important.
Yes.
Can you just talk a little bit about that and the practice?
Yeah, so we do measure quality outcomes, of course, and they're basically around function. One of them is your functional capacity. Did you improve by participating in cardiac rehab, and how do you measure that? So we generally do a pre-6-minute walk, and then when they get close to graduation, we do a post-cardiac rehab 6-minute walk. If they can't do a 6-minute walk, then we measure a MET level, which is a metabolic equivalent.
Okay.
So we generally show probably improvement, and I bet 75 to 80% of the population. The other measure right now, we do patient satisfaction surveys, of course, about the department because we can always improve. And then we have them do a PHQ-9, which is a mini depression scale, kind of quality of life scale. So we address, how are they feeling? Or do they score with a mild depression? That's important for a provider to know so we can help them with that or refer them to the proper resource. So we do a pre-PHQ-9 and then a post, which is that mini depression scale. And we see improvements in that probably 90% of the time, at least.
Wow.
And then we do a diet survey. We have them do their plate and how they're eating. And then based on our interventions, did their diet improve? The individual education and the handouts and then the diet talk. So those are our main outcomes that we follow and measure.
And I'm going to back up just a little bit. You talked about Drs. Andesman and Rogie and Wangenheim, the local cardiologists,
Yes.
Jennifer Thurmer and Allison Malmberg, the nurse practitioners, and all those patients. But you also see patients that may have had to go to a large tertiary care center to have surgery or some complex cardiac, but they choose to come back here for that personal touch. And frankly, the outcomes being, I will say, just as good. I won't forward and say better, but maybe I will say better. Because of what you and your team have done. And just for the audience again, so these are folks, many people in the audience have relatives and they understand what cardiac rehab is, but others don't. So these are people, these are adults, middle-aged and older who have had some type of heart problem that's been corrected. And now you've got to get them back on that next line. What challenges do you see in working with that population?
So generally the first challenge is just, they're vulnerable. They're not sure what's happened, wrapping their head around the diagnosis. They're scared. Their confidence is down. They're walking into a place that they probably never, generally exercise or using equipment wasn't part of their scene ever. Mm-hmm. So just again making them feel comfortable, saying, I always say you don't need to know how to use the equipment. We show you, we assist you, and then as you get more comfortable, if you want to do something else, so they begin to relax, so that's just one of the challenges. And then also the challenge of getting them to modify their risk factors, educating about the risks. And we try to take a hands-off approach because, we don't want them to feel bad for like smoking or,
Right.
it kind of gets, but we give them the resources and the information that hopefully they need. And, really the exercise, as you're an avid exerciser, exercise makes you feel better.
Right.
So it really makes our job, easier because they feel better after they leave a session. We do a lot of med reconciliation. Sometimes we have the luxury of seeing them 3 days a week. So we see their heart rate response, their blood pressure response, what's going on with their rhythm. So we can give that information to our cardiologists, who, by the way, are so accessible, and the nurse practitioners, and so approachable that it's just a really nice collaborative relationship, I feel. If we need to get a hold of them, there's no problem with that. We call them. We talk to the cardiologist probably once every other day when we're exercising with people, and they're very responsive. So
Yeah, another huge advantage of a system like ours, right? And I love how you brought up these modifiable risk factors. Look, we've all done things in our lives that that we wish we could undo, but we can't. And so how do we move forward? And that's how support and reassurance helps folks, whether it was from smoking or from diets that weren't controlled. You can make a difference now. Now is the time, and you don't worry about the past. You just move forward. But on that same token, for people that haven't made it to cardiac rehab yet because they haven't gotten into such a situation, either from genetics or from risk factors, other risk factors, what type of preventative things would you suggest for these folks to pay attention to? And they may be some of the same stuff we've talked about.
Mm-hmm. I think getting moving just a little bit. People need to get up and move, and that can have such benefits long term. Not just even if you go out for a walk, or people say, well, I can't, or just somehow trying to fit exercise into your day. It doesn't have to be much at first. Exercise is progressive in our department. They don't start off going gung-ho. They usually leave the first day and say they could have done more. So I think getting moving, and also obesity is a big problem in this community. And if they can, if they could lose weight, that has other benefits, because then you feel better, and then your joints probably feel better, and you start to move more. And that's a challenge, weight loss, as you know.
Oh my gosh, absolutely. And for those in the audience, we're kind of moving into a different part of the conversation, you may think, but we're not at all. That is one of those things that we're talking about, those modifiable risk factors. And really, very few people can do these things on their own. They need support from professionals like Patty Ryan, or friends, family, and support groups, and just never give up, because every time you make an improvement, you have less likelihood that you're going to be working with Patty in cardiac rehab, because it improves your overall health. And whether that's joining a walking group, as Patty was talking about, getting out there and moving, to some of the discussion groups on diets. And then, there is a component that you can't really fix directly, that genetic component that hurts people, but you can work on the other aspects. So when we talk about that, what are you looking forward to for the remainder of your career, sort of personally and professionally? I know there was some renovation recently to cardiac rehab, and you have some extra type of equipment and things.
Wonderful. So 2019, we had a patient donation, a few patients, but Mary Evelyn Jerome Lindsay Trust, and then Dave Meiselman and Myra Packman. I hope I pronounced them right. But that allowed for us to expand our square footage. We're in the older part of the hospital, so the lighting was a little dim and it needed, us sprucing up a little bit, and we needed more machines because we're pretty busy. So those were all patient donations. So the renovation actually allowed us to stay open during COVID because we could keep people 6 feet apart, and with exercise. And, I've been to other cardiac rehabs, and ours is really very nice. People don't even know we're here because we're in the back of the hospital. So, even so, I encourage the physicians to come down and, other nurses just to see where it is. But
absolutely, that's a great point. If you're listening to this and you're in the health profession, whether that's actually here at SVMC or in other parts of the community, restrictions are being lifted on who can come into the hospital. If you're vaccinated, you can come visit. Get in touch with Patty; she'll show you around. It's really a sight to see, and then really it's watching the staff work together, as she alluded to, that team approach. So, Patty, before we close here, I know the community, so many people in the community know you because you've affected so many people's lives. What do you do, though, when you're not in cardiac rehab?
So, well, I have 2 girls, 21 and 23, and they've kept me busy, So my husband's family's from Shelter Island, which is way out in Long Island. It's a beautiful place. He was born and raised there, 10 kids. So
wow.
Both my girls, well, one daughter's in New York City working, but on the weekends she goes to Shelter Island. And the other one just graduated from BU, and she is down there earning some money before she goes to Ireland. So we go down there when we can. I love to golf, but I love to swim. We have a camp at Hedges Lake, and actually I went swimming yesterday, and it felt great to get back into that because I didn't swim much last year. Swimming, in the fresh water.
Right. So, one of the benefits of the part of the country we live in.
Yeah, and I just like hanging out, I like my house. I like my home, and I like to garden. I'm not a very good gardener, but I do like to get out there. But I'm very grateful for having this job as well because, I'm humbled by some of the comments that people make when, through the media and the patients. To get compliments from patients is so special. And, I don't respond to all of them because you can't, but it really humbles you and makes you realize, you're here for a reason, and you have to just keep helping people. That's what we like to do, and we have a great staff. The staff it's very empathetic, and it's an empathetic environment, and that's where the art comes in. I think I read once, and whether you think this is true or not, is empathy is one of the greatest knowledge that someone can have, because it makes you put your ego aside and kind of try to live in someone else's shoes. And I think, the cardiologist and the staff really create an empathetic environment, and it really can make a difference in people's lives.
And that is the art of medicine you led off the beginning of the show with. Well, Patty, thank you so much for joining us on Medical Matters Weekly, and thank you to the audience. I will say cardiac rehab is not the only type of rehab SVMC offers. We have pulmonary rehab, similar situation, the risk factors and modifying those for pulmonary disease. We will have a show about that in the future. I'd like to go ahead and thank Mike Cutler from CAT TV, Ray Smith from Southwestern Vermont Healthcare, and Ashley Jowett from Southwestern Vermont Healthcare. Next week, we will have Dr. Megan Gunn of SVMC Pediatrics to address questions about the COVID-19 vaccine for kids and any other questions people may have regarding pediatrics. You can send those questions to wellness@svhealthcare.org. I'm Trey Dobson. Go out and find joy in everything you do, even in the face of adversity, and we will see you next week.